So when I was a medical trainee, I took care of this elderly patient who came into the hospital with a severe urinary tract infection. And the thing that stuck out to me at the time of his admission was that someone in the hospital gave him this plush red blanket. And not all patients got a red blanket, and for the next couple of weeks, I would see him every morning to examine him and notice this expensive looking red blanket that would always be on top of his sheets. The other odd thing is that every few days, someone, I don't really know who, would come by and drop a gift in his room. First, it was something small from the hospital gift shop, and then as his hospital stay grew from days to weeks, the gifts sort of became more extravagant. Like there would be these big glass vases with fancy flower arrangements, or these comically large gift baskets that were left by the window. The patient's room was also one of the best in the hospital, with these wide, expansive views of the surrounding city. As it turns out, this patient was a wealthy donor, and for obvious reasons, very well liked by hospital leadership. I later learned that this patient had VIP syndrome. VIP as in very important person or very influential person. What I didn't realize as a trainee that I know now is that taking care of these celebrity patients can be deadly. Let's talk about it in this video. Most of you likely know Steve Jobs, co-founder of Apple, who invented the thing you're probably watching this video on. Jobs was diagnosed in 2003 with a rare form of slow-growing pancreatic cancer. This type of cancer is often curable with surgery when caught early, as it was with Jobs. But at the time of diagnosis, Jobs made the decision to forego usual cancer treatment like surgery, chemotherapy, and radiation, and instead opted to treat his cancer with fruit. Right, fruit. 9 months passed and the cancer spread before Jobs decided to get surgery, and he unfortunately passed away from the disease a short time later. These stories about celebrities getting treatments from medical professionals that are wildly outside the standard of care is unfortunately not uncommon. I think about Elvis Presley, who died at the age of 42 from a heart attack that was brought on by an overdose of prescription drugs. His doctor, Dr. Nick, had written 200 prescriptions over the prior 2 years, with about 10,000 doses of sedatives, amphetamines, and narcotics. Elvis apparently had this addiction to prescription drugs, and he needed uppers to start his day and downers to get to sleep, and his doctor perpetuated the addiction to meet the demands of his crazy tour schedule. I also think about Michael Jackson, who died in his home at 50 years old from a heart attack after getting a cocktail of sedatives that included medications like propofol, which is a med that's typically only used for patients before surgery or in the ICU and requires close monitoring by a whole team of medical professionals to be safe. His doctor eventually was sent to prison for manslaughter. It's unfortunately a similar story with Prince, Anna Nicole Smith, Heath Ledger, and Lisa Robin Kelly, who all died from overdosing on prescription drugs written by a doctor. It's not just Hollywood celebrities overdosing on drugs who are the victims of this VIP syndrome. It also affects politicians who have star power that can sway medical teams to practice outside the standard of care. So as an example, President Gerald Ford was discharged from the hospital with an ear infection before doctors realized it was actually a stroke. More recently, Senator Ted Kennedy was diagnosed with a brain tumor and recommended against surgery due to the risks involved. But then he used his considerable influence to get a neurosurgeon to do the operation anyway. He ended up passing away about a month later. When former President Trump got COVID in 2020, he was prescribed hydroxychloroquine, despite clear evidence that it didn't work for COVID. And when his COVID worsened, he was sent to the hospital and got this treatment regimen that included zinc, steroids, and an experimental antibody, which were all medications that were not yet approved for COVID or found harmful in all but the most serious of cases. So why does this happen? Why do celebrities and people of influence end up getting worse medical care? Well, the problem with VIP syndrome is that the quality of care may be inferior because healthcare professionals may deviate from standard practices when caring for them being patients of considerable influence. So doctors have to make hundreds of medical decisions every day and are usually looking after dozens of patients using well-studied evidence-based practice. These decisions are for the most part reflexive and algorithmic, with the occasional exception when someone has a really unique diagnosis or a really unique presentation or doesn't seem to be responding in the typical way. The problem then is VIP patients throw a wrench in that decision-making workflow. So instead of taking care of a 76-year-old with a mild case of COVID, you're now taking care of the President of the United States who is asking for medications that you know don't work. Sometimes it's a request that seems harmless on first pass, like being thorough with an extra test or choosing an alternative medication that still works. But other times, like in the case of Steve Jobs, the request can really be far out from the standard of care and frankly bad for the patient. David Angus, the cancer doctor who took care of Steve Jobs, said in one interview, some of Jobs' doctors strayed from solid medical science. He had some well-known physicians telling him to do things that made no sense based on the data. Sometimes the negative consequences are obvious, like if there's a request for an unnecessary procedure or a medication that's clearly harmful. But even then, docs have to tread carefully when disagreeing with someone with significant influence and power. In this article, for example, dozens of doctors reported that they were reprimanded or put on probation or even forced to resign if they didn't give in to the requests of influential patients, requests that were likely outside the scope of usual medical practice or interfered with the normal triage process in the hospital that is meant to prioritize the sickest patients first. There's also these non-medical factors that can contribute to suboptimal decision-making when taking care of VIP patients, like navigating special requests, finding extra space in the hospital for the patient's entourage, and dealing with media scrutiny. All these extra factors can strain a medical team's workflow, which means it's easier to make bad decisions. VIP patients also affect every other patient in the hospital when they hop the line to get more urgent testing, or have staff that take up extra hospital beds that could have gone to caring for more patients, or demand more of a doctor or a nurse's time that might have been better spent with someone who is sicker. So what can be done about this? Well, this is really hard because there's always going to be influential patients that can't be treated the same way as everyone else, even if everyone, including the patient, wants to be treated the same. I mean, if the current president were to be hospitalized, you can bet the world would be scrutinizing every action by the medical team and hospital administration. I thought this paper's solution was interesting to expand a hospital's disaster planning to include the arrival of a celebrity and to try and control for non-human factors like traffic flows, emergency signage, and access policies. I also think it's important to call on hospital administrators to think twice before putting pressure, whether implicit or explicit, on hospital staff to treat celebrities differently than any other patients. Hospital staff are already primed to provide non-standard medical care for influential patients as it is. Finally, if you're a celebrity, you probably want to think twice before asking for special treatment. Otherwise, you might actually be getting worse medical care. There's a lot more to talk about that we didn't get to in this video, like what happens when doctors doctor their colleagues, or the different ethical issues around celebrity treatment. That'll have to wait for another video. Thanks for watching.